It's no secret that GPs are leaving and have already left the profession. It's also well known that many GPs do not work full-time, and if they do, they plan to reduce their hours. The pandemic has been a major reason as to why GPs are leaving, but this is not the only factor. Well before the pandemic, GPs highlighted several issues that would affect the number of hours they chose to work or whether they stayed in the profession. If you aren't aware, I resigned from my job as a salaried GP a few months back now, and in this video here, I detail some of my reasons for leaving. Well, in this video, I'll talk you through 5 major reasons as to why GPs are resigning and even leaving the profession entirely. And welcome back. If you're new, then a massive welcome to you. My name is Dr. Baptiste. I currently work as a remote GP. If you want to know more about remote care and what it actually involves, then check out this video where I discuss the advantages to working remotely. So if you have followed me, then you will know that I talk very highly of general practice. However, there are pros and cons to every career, and I have spoken about the pros and cons to general practice in this video here. There were many things I did not talk about in that video, such as job dissatisfaction, complaints, and burnout among GPs. These are all important things to be aware of, especially if you are to make an informed decision about choosing general practice. So what are the numbers? Well, last year, figures from NHS data showed that the numbers of GPs working full-time, so approximately 37.5 hours per week, per patient had dropped by 10%. The BMA reported that 32% of GPs were more likely to retire early, 21% were going to leave the NHS in pursuit of another career, and 17% stating they were more likely to work abroad. 50% were also more likely to work fewer hours. This year, a report by the Medical and Dental Defence Union of Scotland, or MDDUS, has shown that 51% of GPs were thinking about leaving or retiring early. Okay, so we know what is happening, but now we need to know the why. Why are GPs leaving or reducing their hours? Workload and job dissatisfaction. Prior to the pandemic, GPs expressed an ever-increasing and demanding workload. A survey by Pulse revealed that GPs felt they were forced to work in unsafe conditions. You can check out my Day in the Life vlog where I detail a typical working day. One of the reasons I worked part-time as soon as I qualified was because working those type of shifts every day is tiring in more ways than one. Long hours, seeing 30 plus patients, in addition to admin and on-call duties, can take a toll on you, physically and emotionally. This affects your work and the quality of care you can provide for your patients. Your home and family life are also affected. In this same survey by Pulse, approximately 1 in 10 GPs reported 60 patient contacts or more in a day, so double what is seen as safe. There is also clinical complexity, which means that many cases are challenging. This could be due to multiple comorbidities, polypharmacy, and therefore drug interactions, and a complicated presenting complaint or multiple symptoms. Survey respondents said 29% were very complex and 37% fairly complex. Despite the above, job satisfaction did rise, albeit slightly, from 2017 to 2019. And this was based on a survey conducted by the National Institute for Health Research. However, this may be due to more GPs working less than full-time. A new survey is currently being conducted which will help to elucidate the impact of the pandemic on job satisfaction, mental health and burnout. In an article written by Claire Gerarda, who many of you may be familiar with, she talks about her experience of burnout. She states that burnout is formally defined as a state of physical, emotional, and mental exhaustion caused by long-term involvement in demanding situations. She goes on to say that she sees it as destroyed individuals, shells of their former selves, damaged by the fire of their work that rages around them. I have personally spoken about burnout in previous videos. Given the increasing workload and now the pandemic, many GPs are suffering with mental health issues and of course burnout. What many GPs do day in, day out is not sustainable. So is it any surprise many are suffering with depression, anxiety and burnout? A survey conducted by the BMA earlier this year revealed that 58% of doctors are suffering with anxiety or depression, with their mental health worsening since the pandemic began. The media. There have been many examples in the media where GPs have been portrayed as rich or chasing money or not seeing enough patients or not seeing patients face to face. Two recent examples are articles in the Telegraph. The BMA sent a letter to the Telegraph in response. Moreover, some clinicians in the hospital do not portray GPs in a positive light. I have personally heard many negative things said about GPs when I was a medical student and a trainee. Complaints and abuse from patients. GPs are more likely to receive a complaint in comparison to hospital doctors. This has only been exacerbated by the pandemic. A medical defence organisation has reported a 23% increase in the number of GPs it is helping with complaints. In a survey conducted by the Medical Defence Union or MDU and the HLA or Healthcare Leadership Academy, 97% of GPs have received a complaint during their career. This is no surprise there are so many patient contacts in a given day or week, and that patients are more likely to see their GP than any other doctor. GPs felt that the main reasons for complaints were due to longer waiting times and delays in tests, communication issues, and online or remote consultations instead of face-to-face appointments, especially with lockdown easing. Issues with appointment availability was also mentioned, despite evidence from the Health Foundation revealing otherwise. There were a record number of appointments during March 2021 compared to March 2019, pre the pandemic. GPs have also reported receiving abuse in the form of assaults and threats. A survey by the Medical Protection Society or MPS reported that 52% of staff helping to implement the vaccination program were threatened with physical abuse. GP surgeries or vaccination centres have also been defaced. GPs have also reported being subjected to racism and sexism, according to one poll. The pandemic. COVID has brought about new challenges on an already stretched and demoralised workforce. The above report by the MD-DUS revealed that 81% of GPs said that their work day-to-day was significantly disrupted by staff self-isolating, and 29% felt that infection control measures undermined their ability to care for patients. There were many reports of a lack of PPE and a lack of adequate PPE at the start of the pandemic. Furthermore, before you can start work, you have to ensure the area is thoroughly disinfected. Before and after you see patients, you have to do the same. You also have to wear and constantly change PPE. Although very necessary, it does add more time and effort to an already demanding day at work. Then, remote consulting in itself can take longer as you cannot physically see the patient and examine them. If you are going through an e-consult, you have to read the completed form first, then you may have to call the patient to understand more, or construct a very detailed email with clear instructions and safety netting, for example. So in some ways, remote consulting is harder than seeing patients face to face. If you want to know more about the disadvantages to remote consulting, then check out an earlier video. So those are just some of the reasons why GPs are leaving their profession. There is significant pressure placed on GPs, but despite this, many still remain and still enjoy their job, even if that means reducing their hours. Many GPs or doctors in general go above and beyond every day to ensure patients receive the best care. This can be at the detriment of their own physical and mental health, as well as to their personal relationships. It would be good to hear your thoughts in the comment section below. If you found this video useful, as always, then be sure to give it a thumbs up. I'll see you in the next one.